Well, a new study of America's fastest growing sport, pickleball, shows that injuries are actually on the rise.
It could cost up to $400 million in medical injuries.
I planted my left foot, felt it pop.
Knee pain while playing pickleball? You've come to the right place. Hi, I'm Dr. Justin Lin, sports physical therapist at Rehab and Revive. We've got a comprehensive pickleball knee injury care plan and exercise routine for you coming right up. So why does this happen to those of you who specifically play pickleball? Let me list a few possible reasons from my experience. Short courts, stop and go and change of directions, and avoiding collisions with your partner. Or something as simple like you're not following through completely, your hip is weak, or your ankles lack mobility, and shoe wear. Good news, you came to the right place, because the reasons are one and all of the above. So we're gonna get right to the demos. Stay tuned. We're gonna get right to it. So, right here, let's just do a tester leg here. Let's see. This one kind of turns in. What needs to happen is that if this feels blocked or it starts, I'm exaggerating, starts going up and around, your goal, put your heel of your hands on this area, press down. So you're gonna press down, and you can see right now, I've got maybe about 10, 15 degrees internal hip rotation. On this side, I could get maybe 45. So this side is not the issue. It's this side that's the issue. So I'm gonna keep trying to squeeze my butt or clench my butt and maintain that rolling. So I'm just rolling it in and I'm pressing it down. So you can use both hands if you want. You can use your fingertips. You can squeeze and roll. And what you're gonna feel is there's a part, your hip isn't a perfect ball. It's got a little notch in it where the head of the femur is. And it just basically keeps like chipping down into the groove. So it's gonna be chipping and in. And then all of a sudden it just sits in a nice pocket inside your hip or your pelvis, that is. So we're gonna keep doing that. I'm gonna tighten it. And the muscle contraction is really also helping draw it back. So we're just drawing it in, and it's about to go in. I can feel it you'll feel pressure right in like that pubic area, that groin area. A lot of you who have groin pain as well, believe it or not, you probably have this issue. So now you can see all of a sudden it dropped in, and now when it was just here, I can take it here. Good. Now I'm gonna supplement it with hip holds. Like I said, I have more explanation in the full videos of these specific exercises, so we'll just link all those guys up in the descriptions box. What you're gonna do next is, now that it's in the socket, it doesn't know how to live there. And so what we're trying to do after that is, you gotta get this, I'm pulling kind of this way. My leg is going in an arc-like manner down towards the table. So you don't need to do it this way, you want this way. I kind of like my foot in this dorsiflex or flex position. So you're gonna squeeze your butt, tighten it, and it's starting to shake. And you can see like my hip probably hasn't lived there in a few weeks now in the right spot. So it's gonna shake, and I'm just holding it till it finally like fatigues. What that means is, for my mentors, that the phasic shake is the phasic muscles, those fast twitch muscle fibers, so they get tired. And when they finally get tired, the tonic muscles, those slow twitch endurance muscles, finally kick in. So that's what we're doing. And now it's solid. So let's just recheck it before we move on to the ankle exercise. And there we go. Cool. Perfect. Third exercise, the ankle derotation. You'll notice, like I said, a lot of times all of you guys just can't get into internal rotation. This one's doing better because of the hip exercise I just did. This one could do some, but look at this right here. You can see that. And this one, not as great. How you can also test this, take your heel, you're gonna jam it in here, and you're just trying to get that knee forward. And what happens is, it's gonna run right into my heel. There's actually pressure right here. And so I'm just trying to work it in, out, in, and then your goal is to be able to get that knee over your toes. If you can't do that and it's painful, that means you need this exercise. So we're going to get that right in there and starting to free up now. And that's just a lot better, especially for those golfers too, all out there. But we're talking about pickleball. It's been a lot of fun for my friends and I. We'll just go out there, more recreation, less competitive. Some of us get competitive, but I just hang out and actually just usually end up having a drink in one hand and hitting the ball with the other, and I don't take it as seriously as they do. But you'll see this side, no issues. I can go right over, and that's easy. So you should do both. And yeah, there's that exercise right there, real quick and easy. The fourth and final exercise, you need a ball, middle crease of your knee, kind of in that runner's position, and you're just gonna push in. Now, how much you wanna put is up to you. We're just gonna go right into here and then back off, all right? Pressure on, pressure off, pressure on. If you're shaking, that's okay, but you're gonna do a number of these till it burns. And it's gonna keep burning. So pressure on, pressure off, pressure on, pressure off, pressure on, pressure off. Ideally, rough range, probably 30 to 50 times. And then you switch sides, right? So right there, you're gonna feel a couple muscles working on here, right here. And the soleus muscle right there. So there it is, a little bit more closer up. All right, here we go. Let us know your thoughts on our video. Leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter.